concern for Bangladesh in crowded camps that pose increasing challenges for the women and the girls right now. And similarly, Turkey is a nation that hosted over millions of Syrian refugees, and likewise, Pakistan is the third largest refugee hosting country for Afghanistan. So my question to you is that what could be the technical advice based on your lessons learned to support the key considerations for future program learning and adaptations for gender-based violence, programming mental health problems, and how to apply a survivor-centered approach for data collection to overcome these challenges, and the way forward in fostering coordination and collaboration within the region, like South Africa, not South Africa, Africa, South Asia, Southeast Asia. Yeah, over to you.
Thank you very much, Zara, and ladies and gentlemen, thank you very much for including me in this very important webinar. It is a great honor to be here. Before I talk about the way forward and data collection, I think it's very important to remind ourselves of the magnitude of the challenges that are being faced in the Rohingya refugee camps, from which I have reported on numerous occasions, in particular in the height of the most recent exodus, which started in August 2017. Now, according to the charity Relief Aid, this past year has been the worst year for the Rohingya refugees living in the camps, of which there are more than 1.1 million, and they actually go back to 1992. That's when the first arrival started settling in southern Bangladesh. Now, the reasons for this are multitude, lack of resources, limitations when it comes to food, health products, sanitation, lack of educational resources, and they've also been susceptible this year to a number of natural disasters which have particularly affected the camps, which are already overcrowded. That includes fires, floods, cyclones, and many of them have been, you may be aware, moved to a remote island about 100 or so kilometers from the southern Bangladeshi coastline, which is even more susceptible to prones and floods, to floods and cyclones than the mainland itself. When we talk about the Rohingya refugees, I think the title of this seminar focuses on gender dimensions. I think we need to make clear that gender issues are very much intertwined with economic empowerment as well. In other words, you can't really look at gender dimensions separately. There are certain factors that apply specifically to women, and in the case of Rohingya refugees, there have been widespread reports about sex trafficking, illegal marriages, which are not policed and which are tend to be more prevalent in these camps than elsewhere. But there are certain factors that affect all the refugees in the camps, regardless of gender, and that is because they are on the lowest rungs of the economic and social strata in Bangladesh. So I think that is quite an important point. We are talking about gender dimensions here, but I think it needs to be, we need to be reminded that gender issues are very closely connected to economic empowerment and social and socioeconomic indicators as well. In the case of the Rohingya, we have been told one of the main concerns for charity organizations operating in the camps has been mental health, brought on in part by the pandemic. The impact of the pandemic has been exaggerated and exacerbated in the camps, but by other factors as well. And some of these mental health issues have manifested themselves in the camps. According to Save the Children, sleeplessness, nightmares, depression, self-harm. According to Save the Children, 35% of children have self-harmed in the past year or so in the Rohingya refugee camps. So these are some of the things that we need to consider, that we need to have on our radar before we talk about ways forward. Specifically in terms of the COVID-19 vaccine, COVID-19, the challenges that are being faced in
Hi, Deshpa.